So now more epidemiology by staff. My name is Hassan, and this is my master research project, the relationship between meat intake and fetal stroke among the adult research study couple. As many of you familiar with the condition, it's a very serious condition, and its risk increase at 8 increases. It's basically a brain attack due to a lack of blood and oxygen to the brain. The main causes here is through thrombic atherosclerosis, but there's other causes too, such as fat embolism, tumor, and trauma, and in some rare cases by infection. The risk factor can be subgrouping in 3 different groups. The first one here, primary risk factor, can be high blood pressure, high cholesterol, diabetes, tobacco, and obesity. The second one is preventable risk factor through diet, lifestyle, smoking and alcohol, cholesterol level, diabetes again, atherosclerosis, high blood pressure, obesity, and transient ischemic stroke attacks. The last one is unchangeable. As we get older, many risk factors in many health problems we face. Ethnicity and family history of stroke and gender. Stroke is the 4th leading cause of death in the United States, and it's responsible for 137 cases per year. And it's responsible also for 1.5 million patients in Europe and the United States. African Americans have almost twice the risk of first ever stroke compared to whites. Approximately 800,000 strokes will occur this year, and approximately 55,000 more women than men will have stroke. The men's stroke incidence rate are greater than women's at younger age, but not older age. It's fact that there is limited number of studies have assessed the association between red meat intake and fetal stroke. One of these studies is conducted in Swedish women, a total of 34,000 women. They followed them for 10 years, and they measured their dietary patterns, and most importantly, they assessed the meat intake. So their finding, they found out that if women eat at least 3.6 ounces per day of red meat, the likelihood of having a stroke is increased by 42%, as compared to those who eat 1 ounce per day. Also, they found that 3 ounces per day of red meat is associated with 22% of increasing the risk. And this is the average of American, they eat 3 ounces of red meat per day. Most importantly, if women eat 1.5 ounces of processed meat, it's even higher associated, the likelihood increased by 24%, comparing with those who eat less than 1 ounce per day of processed meat. So our study aims to test or assess the relationship between long-term effect of meat intake and risk of stroke among the healthy advanced study, the healthy population, and advanced health study. So this is the web of causation and also my hypothesis. I was trying to look if, through the meat status, if you are vegetarian or eating fish or eating meat, and the relation to stroke after controlling for other candidate predictors. So in this flow chart, I was trying to see the relationship in terms of biochemistry, what in meat that could be a risk factor or lead to fetal stroke. You can see it's complicated enough, but I was able to find out 3 substances within the meat that could be a risk factor, including lipids, iron, and homocysteine as amino acid. the study population, we use the baseline dietary information from the frequent food questionnaire and mortality information. This is a prospective study with a total of 70,000 people, and those, of course, never diagnosed with cardiovascular disease and no history of stroke. And we followed up to 7 years. In this flow chart again, the excluding criteria, we start with 84,000 people with valid food questionnaire or food dietary information. We exclude the prevalence of stroke, myocardial infarction, diabetes type 1 and 2, and coronary heart failure. Also, we exclude those with extreme low and high calorie intake, and those with ages than 10 years old. So the final analytic population is 70,170. In this table, we show the total incidence of cases based on the mean status and type of stroke. As you see, we have 64% among overall cases in the category of never or rarely eat meat. And we have 26% who eat less than 2 per week of total meat. And then, but this is not including the fish. And we have 12 cases among those who eat more than 2 serving of meat per week.
Hassan, what is the number inside the that standard deviation?
Here?
Yeah.
It's percentage. Percentage.
Oh, percentage, okay.
Yeah.
Okay.
We clear on it, right?
Okay.
So this is the demographic information. Most of the our cases is in have age more than 75. So we, as you see, less than 75, we have just 36 cases. I have highlighted the 3 variables here that what I believe personally has a major effect on the analysis data. We have more female, 60% of the cases, and we have almost 64% never eat meat or rarely eat meat. And the majority of cases also have a, I would say, healthy or lower BMI. Continuing with the demographic table, we have almost 90% white in this flag. And the majority, of course, non-smokers. So we use Cook's proportional hazard with attained age to assess the relationship between middle age and stroke. We test the assumption proportional hazard by using the life test procedure. And as you see here, to let Dr. Chemistry be interesting, this is the general representative of Cook's model. All the analysis was conducted by SAS 913. So here the main exposure and other candidate variable that consider for the analysis. I start with the basic model, and then I check one by one based on the 10% rule of change. So we end up with the final model here, including this variable. We have, of course, the total meat, which is the main variable as a vegetarian, less than 2 per week of meat, and then 2 and plus per week. Again, here the definition of total meat, we include poultry, lamb, beef, and pork. And the candidate variable, we have fish intake as yes or no, total calorie intake as a continuous variable, and gender, smoking, never versus ever, TMI is 3 categories, less than 25, 25 to 29, and 30 to 40 something. So the time variable used in the course was created as the following. We use age n, basically age of once you complete the questionnaire, and that's considered as a left censoring, and age out as age of censor or dead. And our outcome variable is stroke as dichotomous. We assign one if one of the following type of stroke, hemorrhage stroke, ischemic stroke, or unspecified happen. And sensor we assign for 0, and either